guys. Hello, 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 hello to everyone. Hello. Thank you all for coming. Hello, guys. Hello, everyone. Thank you all for joining me today. Today, we're going to have a host who is going to be teaching us about mental health and the assessments concerning mental health. So, while we wait for our guests to join in, please like, connect, subscribe to my channel. Thank you to everyone who have been supporting me on my channel. I'm grateful. I'm grateful. Thank you to everyone who showed me love. Really, I do not take this moment for granted. As you know, my name is Gloria, and I'm a small YouTuber growing. Or should I say, I'm a big YouTuber now? Yeah. I create content concerning family, comedy, vlogs, cooking, healthcare, everything and anything. It's on my channel. Welcome, Franklin. Thank you for joining. All right. So I create everything. All right. I'm waiting for my host. She's going to join us very soon. On today's topic, we're going to be talking about mental health, because there's a lot of people that suffer with mental health in the world. So we need to be aware of these things, the risk, what causes it, you know, an idea. What are the challenges that they face? Most of us have not experienced anyone with mental health, you know. So my guest, she will join us. She's a nurse, and then she's going to explain to us more about mental health. Okay. So just be patient. She just messaged me. Okay. All right. Okay, she's getting set to be here. Okay, yeah, she's here now. Hello, namesake. How are you? Good to see you too. I want to use this opportunity to say thank you so much for honoring my invitation, for coming here in a very short notice. Really, I am very, very grateful. Thank you so much. Thank you.
You're
Thank you.
welcome. I'm
Thank
happy
you.
to be here and thank
Oh,
you for inviting me.
you're welcome. You're welcome. All
Hello,
right, guys.
everybody online.
Yes. So, guys, as I said, welcome to my YouTube channel. As you all know, my name is Gloria, and I'm a healthcare assistant here in the United Kingdom. On my channel, I talk about healthcare. I do food content, funny content, traveled vlogs, everything and anything. Okay. So I want to take a big shout out to all the people who support me, who take their time to watch my videos, like and comment. Guys, I love you all. Thank you so much. Thank you from the depth of my heart. Okay, let's dive on today's topic while we are here. Today, my guest name is Gloria. She's also my namesake. We met in this social media space on TikTok. We've not seen, but we communicate once in a while. She's lovely. That is why I encourage people to please try and grow or do something on the social media, you never can tell who you can meet. You can meet your destiny helper, anyone, all right? Just be nice and be yourself. So today I have Gloria. She's also based in the United Kingdom, and she's a mental health nurse. So I'm going to open the floor for her. So, Gloria, please, can you tell us a brief introduction about yourself? Let my fans know you, please.
All right. Hello, everybody.
Mm.
Like you already said, my name is Gloria. I'm a mental health nurse here in the UK. I am currently working with the NHS as a ward deputy ward manager.
Yeah.
And I met Gloria as well on social platform like this. And I also create contents around mental health, professional growth, personal growth, and things like that. So I've lived here in UK for over 16 years. I did my master's here, did a 2 years program, and I qualified in 2022. So I'm just about 3 years on the job.
On the
And so
job.
far, so good.
Nice. Wow. Wow, wow, wow. You've done real well. 16 years. That's beautiful. It's
That's
not
a long
easy.
time.
That's a long time. Wow, that's nice. That's
Mm.
nice. All right. I want you to please share with us, why did you choose mental health as a career, or did anything lead to you to becoming a mental health? Just tell us a
Yeah,
brief history or your background.
yeah. Coming to UK, one of the four jobs I got, which I say was just by chance, not really because I thought about it, was mental health. So I did any healthcare assistance
Assistance,
in
yeah. Just like me.
I yes, yes. So I did it mental health. I did it for almost 10 years, and I just like
Mm, yeah. Mm. So now, so yeah, yeah, yeah. I get your video is mute. Your video is mute. I can't see you move anymore. I don't know what's wrong. Yes. Uh, really? Yeah, it's frozen. I don't know why. What's happening? Oh, let me see what's happening. Hello guys, Daddy Child, Net Wachuku, Mary, please can you see both of us talk, move? I can't hear how. Yeah, someone okay, yeah, now you're back.
okay. Oh,
Now
that's
you're
good.
back. Huh. Can you guys hear us? Can you hear us? Can somebody say in the comment section? Because
She
someone just
said
said she can't
they said they
hear.
can't hear me.
But me, I can hear you loud and clear from here.
Okay, so
Yeah.
maybe it's the individual network issues then.
Yeah, maybe.
Mm.
Can you guys hear us? Can you please comment? I can hear from my hand. Yes, she's
Yeah.
okay. Yes, okay. All right. Now they say you are back. Okay.
Oh,
All
that's
right.
good. All right.
Okay. All right. So, as a mental health nurse, could you please explain to us what are the challenges that nurses face as a mental health?
um, okay, I think from being a student or being an NA, the perspective is quite different when you become an accountable practitioner because as soon as you're qualified and you got your NMCP, you become like an accountable practitioner. You're responsible for the decisions that you make. So that could put a lot of pressure on people because as a newbie, sometimes you don't want to make mistake. You're worried about whether your decision is right or not. And sometimes there's no right or wrong decision. Decision.
Yes.
It's about being able to give a rationale and justify why you made that decision with the available maybe resources or knowledge that you have at that point. But the main challenge is also is not getting the right support from the start.
Mm.
Because as a preceptor, you're supposed to have assessors, you're supposed to
Yes.
still be under kind of supervision to an extent, get a
Mm.
lot of support. But the nature of NHS is that, due to understaffing issues, problem with the workforce, people don't get enough support, and that could cause
Okay.
a lot of stress
Stress.
and sometimes incompetencies because they're not given enough time to do their training and to get
Mm.
feedbacks and things like that. So it puts a lot of stress on the newly qualified
Provide
people.
people. All
Yeah.
right.
So
Okay.
that's one aspect of the challenge.
Yes.
Then sometimes dealing with service users, because mental health, most of the patients are sectioned, so they
Mm.
are there against their will, you know.
Yeah.
And sometimes they don't have insight into their illness. They don't think they are ill. They don't think they need to be in hospital. So I feel like that's the main challenge for me, even up till today, because you're trying to support someone that doesn't want to be supported, someone that
Supported.
sees you as the enemy sometimes. It
Hmm.
can be difficult because, you can get all sorts of abuse.
Abuse, yes, because you're trying
Not,
to make them be
not,
on your own level.
yeah. So that can be emotionally challenging as well.
Wow. Okay. All right.
So,
I'm going to leave the floor for you to please
mm,
explain and teach us about mental health, the risk assessment of mental health, because
okay.
most of us might not, maybe we don't have families or anyone who have mental health, but in the future, you never can tell. Like I never believe I'm going to do healthcare, but I'm here.
Mhm,
So I learn
mhm,
every day. So you never you never know what happens tomorrow. You might get a job as a mental health person. So with this little information you might learn today, it will boost
mhm.
and help you know the right way and the right thing to do. So I'll leave the floor for you, please.
All right, thank you.
Okay.
So, with mental health, I don't know how many people here are professionals or already working in this sector,
Okay.
but mental health is something that a lot of people are still ignorant of, and there seems to still be a lot of stigma around it. I think it's important that we educate ourselves around this and try and support our family members as well, because it's not necessarily when somebody is in hospital that they're unwell. Some people struggle. A lot of people in the society are still thriving, you know, in their job, in their, you see them, you will never guess anything is wrong with them. Just the same way somebody maybe with physical illness like diabetes is still living their life in the community. They are not in hospital. So the fact that somebody is not in hospital doesn't necessarily mean they are
That's
not
fine.
struggling. Yeah.
Mm.
And with mental health, there's what we call long enduring illness. Some of them like schizophrenia, maybe some chronic depression that people struggle with. They have to live with it for the rest of their life. Sometimes it's just treatment, there's no cure to
Mm.
it. So, and these people, what we try to do in mental health now is to get people to live in the community and still
Okay.
manage
Yes,
and thrive
yes,
in the community with their illness as
yes,
well. Yeah. So it's important that as not just professionals, as a mom, maybe as a friend, that we have an understanding of this and we're able to support each other and also find out sometimes what the triggers are or the signs of mental health deterioration in a person and
mm.
be able to offer appropriate support. Appropriate support could be just to encourage the person to go see their GP. If you're
Okay.
not a professional, even as a professional, that's what you would do anyway. But then ongoing support in the sense of non-judgmental being non-judgmental,
Yeah.
um, offering support, friendship, just simple things like talking, going out. Somebody is
Mm.
depressed. You could just try to engage the person, find out how they're doing, find out maybe activities they love, and encourage them to participate. Yeah. But most importantly, also to speak to a professional about it. So it could be their GP. GP could start with maybe signposting them to organizations, maybe
Mm.
charity
Go
organization that support.
positions.
But if you get to a point where the person is maybe really unwell and they are really themselves and reach to others, then they might have to be sectioned in hospital. So that's why some people have to be in hospital, because their risk is such that they can't manage safely at
Mm.
home in the community. So it's either they might neglect themselves to the point that maybe neglect could be that they are not eating.
Okay.
Maybe they are hoarding things at
Mm.
home, causing health hazard, causing even fire risk. Some of them might even be playing with things that are kind of dangerous because of
Yeah.
that lack of awareness. So in that situation, that person might benefit from being in hospital where they'll be looked after until they are well enough again to manage or have the appropriate support.
Mm.
Because there might be people that will have to go to a supported living
Yes.
accommodation where there is 24
Individual.
hours care.
Okay.
Even though it's
Yeah.
not hospital, there are still staff available to support them.
Yeah. That's
So yeah, and then there are people that might be out of reality with uh with out of reality, basically people that might hear things or see
mm.
things that are not there. They are responding to unseen stimuli. They might be hearing voices telling them to do things that might be negative or positive. Sometimes the voices they hear might be positive, actually, in the sense that they make them feel good. Whereas other voices might be derogatory, telling them bad things about themselves, telling them
Yeah.
negative things that are
Negative
actually quite
things.
distressing.
That's why there's a lot of suicide.
Yes, yeah. And there might be people that hear command hallucination where the voice is telling them go and do something, negative things as well. Go and harm somebody or go and harm yourself. You are worthless and all of those things. So people struggle with all sorts of things. In paranoia, so you might think, oh, I've not done anything to this person, but the person sees you and think you've done something,
Mm.
just paranoid over different things. So
Yes.
these are the signs and kind of signs that somebody is unwell. And with depression, also could just be people losing interest in what they normally love doing. You
Mm-hmm.
see somebody that like going out, all of a sudden they are withdrawn. They
On their
just don't want
own.
to socialize. Mm. They don't even want to leave the house anymore. Sometimes tearful, sometimes thoughts of harming themselves, thoughts of ending their lives.
Mm.
So all of those things, when you put them together, the assessment would be how can this person, are they able to cope with this? What kind of support do they need from the start? Is it something medication? Is it enough? Or do they need the presence of other professionals just to actively, support them
Yeah.
until they get over that phase? So when somebody comes into hospital, so that brings me to the assessment bit. When somebody comes into hospital, first of all, as a professional, you would have looked at their history. So assuming the person has never been in hospital for the very first, and that's their first new admission, then that means the A&E department, because we still have liaison
Mm.
accidents, we have professional mental health liaison, so they're like accident and emergency department where the
Yeah.
person will be triaged and assessed and triaged. So they would have gotten some kind of bits and bits
This
of
is-
what's going on with the person, their
Yeah.
family history, what they do, how the issue started, and all of that. So by the time they come into hospital, our job also is to carry out further
Investigation.
assessment,
Mhm.
investigation, yeah. And that could be speaking to their family, their friends, their carers, people that know them well. with with consent. Sometimes, or even without consent, you can gain information without sharing. So
Yeah.
if you are trying to gain information, you might not necessarily need consent because you're trying to get a proper picture
Of
and
the
offer that kind of holistic support rather than just one-sided. So it's important at that point, get all the information as possible, read up on their history if they've already been in hospital before, speak to these patients as well if they want to engage and they want to. Sometimes they will engage, sometimes they will not. But if they engage, it's also a good time to ask them exactly what the issues are. So in mental health, like I said, there are different categories of risk. So risk could be to self, yeah.
selfish, yes, the ones
So
that harm themselves.
yes, self harm. So assuming somebody is self harming, you are not just stopping at self harming. You want to find out what sort of how do they harm themselves,
Hmm.
yeah. What do they use? Are they
Okay.
using razors, sharp objects? Is it ligature? What sort of self harm, and what is the intention behind that self harm?
Hmm.
Sometimes the intention could be to end their life. So we need to ask that question. Do you have any thoughts of harming yourself? We're encouraged to do that. Don't shy away from that subject because it's very important to talk about it. So,
Hmm.
what is the intent behind the self harm? Is it to end their life? Or is it kind of to release tension? Because self-harm serves different purpose for people.
Hmm.
Sometimes people just want to. It's a way of releasing tension.
Hmm.
It's a way of coping with the feelings they're having. So it can serve that purpose for them. But at that point, you might just ongoing support will be to find another way of them coping that is different from that. But taking that,
Usually.
yeah. So, but taking that coping strategy from them right away might actually cause more harm than good.
Hmm.
But I'll not go into that anyway. There's something we call harm minimization.
Hmm.
Yeah.
Okay.
Yeah, but I'll not go into that because it's good to understand it as a professional rather than talking about it publicly. Publicly. So in that self-harming domain, you will find out what the triggers are, what
Hmm.
triggers the person.
All
Because
right.
some people they don't self-harm all the time, but maybe they receive negative news.
Yeah. Or somebody, for example, maybe they want something and then they're not getting that thing. That
Yes,
was
yes.
that trigger. Hmm.
Sometimes it could be birthdays or memorable
Several
days.
things.
For instance, if it's the day they lost somebody important in their life, it could be a trigger. Yeah.
Hmm.
Sometimes it could be something as simple as too hot, too cold, or even hunger. Basic needs, or maybe financial worries. All those things can trigger someone. So it's finding out what the triggers are and what is the early warning sign as
Yeah.
well. So early morning sign could be that the person will be pacing around, or they will be even more withdrawn than normal, or they can start head banging, or they could, it could be anything. But identifying all those things help because when you know that, you can offer early support before it gets to the point where the person actually starts to harm themselves.
Those.
But if you ignore or you are not aware of those early warning signs, then by the time by the time staff actually gets to know is when the person is actually becoming very agitated or actually harming themselves at that point, and it should be more difficult to stop the person,
Yeah.
which is why
Yeah.
sometimes restraints happen, which is something that we don't want to see. As much as possible, we try to avoid using any restrictive practice. So the earlier issues can be resolved, the better. So you try to use appropriate measure at the right point. But then in worst case scenario, if you tried every other option and that's what you have to use, then that's fine. So all these things, getting a picture of the signs, what the risk is,
Mm-hmm.
how the risk happens,
Happens.
what causes it,
The
what
trigger.
triggers it. Yeah, it's so important. And then putting a management plan in place to support the person, or developing a safety plan with the person. So you're looking at, in terms of safety plan, is what would you do if this happens? So if you're feeling like this, who do you want to call, or how do you want staff to support you? Or giving the person the necessary information as to the right organization to seek help from, or the
Mm-hmm.
phone numbers. It could just be like saying call 999, you
Mm.
know, or press your bedside.
Side, yeah, yeah.
Yeah, if the person is in hospital, or come and speak to a member of staff, or some people can have the stimulation rooms, like quiet room, where they have things that could suit them, or they could use things, self-soothing toys and all that that could help. So it depends on what can help the person. That's another thing you want to identify during
Mm.
the assessment. What helps you in this situation? How do you want staff to support you? Is important. And then you tell them also what will happen if this happens. If staff tried all of these things and we have to get to this point, this might be what we would do. Eh, So it just helps having those conversations and building that rapport from the
Yeah.
start is very important.
Mm-hmm.
Then we have also the risk to others
Wish
as
to
well.
that. Okay.
Yeah. So risk to other could be, it depends. It could be anything.
Okay.
Some people can be, maybe people historically, we don't know, somebody with a forensic background. Some people have been in prison. Some people,
Mm.
you look at all those histories in the past. Some people have anger management issues. Some people cannot tolerate some certain things from other people. Some people are having those voices that tell them to go and command hallucination to go and do
Yeah.
something.
Calm
Sometimes
themselves.
yeah, sometimes it could be sexual disinhibited behavior as well, touching somebody inappropriately, all those kind of things. So we want to identify all of those
Yeah.
risks. What sort of, is it punching? Is it weapon? Do they use weapon? We want to also see the level of risk,
Yes.
have a conversation around it. I have also talked about self-neglect
Mm-hmm.
as
Needed.
well.
Yeah. Yeah. Sorry, I want to continue. I want to ask a question.
Yeah.
Most of this mental health,
Mm.
are, from your experience, are they genetic, or as a majority of them, are they genetic, or it just happens?
So genetic, probably there could be people that are more predisposed genetically to develop some certain things,
Mm.
but well, that's part of it. But I think there are other real reasons why people develop mental
Mental.
illnesses. It could be stress. We have stress-induced
Mm.
psychosis.
Yeah.
With depression, for instance, could be that someone is uh, something
Voice,
significant
stress.
happened in their life. Yeah,
Yeah.
something financial, huge financial loss can destabilize somebody and can lead to depression. And somebody losing maybe a loved one, somebody important in their life, stress, even normal stress, like how me and you we do night
Night
shifts and
shift,
all that. That
yeah.
can be, yeah.
And then
So
they do a long day shift. You,
long day shift, you're not getting enough rest.
yeah.
You are panicking all the time, running
Yes.
around.
That's why I
So
stop.
stress,
That's why I don't think for overtime. That
yeah,
overtime, it's better your if your off day, just rest. I'd
just
rather
use it
be
to
here
use.
on my YouTube,
Yeah,
learn, meet people that stress myself, honestly.
yeah. It's important.
Because
Unfortunately, there are some people that are in a position where they can't afford to, but I think that would be another topic maybe for another day,
another day.
how to manage yourself. Because at the end of the day, um,
Yes.
your work, you're not living, you're just surviving. And if you become too poorly, and then you're not able to do anything in that
Thing.
at all. Uh, so and then there is drug induced psychosis
This
as well.
is
So yeah, we already know about the illicit substance in the society. They're quite rampant, and a lot of people sometimes. they can't relate it, so it impacts them negatively. So there could be different reasons why people suffer a breakdown or you know become mentally.
Wow.
Mm.
Wow. 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 Wow.
I
You've
don't know. Maybe
okay.
somebody
Can you
wants to
ask
ask a
questions,
question.
guys?
Mm.
Please, do you have any questions? Let's so that we'll know. Can you type your questions? Like someone, okay, let's say Nachi what TV said, it's very important to know what triggers it in order to
Yeah.
avoid these things. That's true.
Mm.
That's true.
Mm.
Daddy's child right is a very sensitive job. Very, very. It's a sensitive job.
Mm.
Okay. I'm trying to see if there's anyone with a question. Okay, questions are not coming. Can you please tell us the
Okay.
types of mental health that we have, if you know of any?
Okay. Do you mean the diagnosis?
Yes.
Okay. So there is schizophrenia, which
Mm,
I've talked about.
yeah.
So people being out of touch with reality,
Mm,
yeah, and this can present in different ways. Sometimes it could be grandiose delusions when the person is delusional, so they think they are something they are not.
mm.
So somebody might say they are a president, or even say they are God.
Yeah.
Some might say they're a millionaire, they're wealthy, and all those. So those can be delusion, or they've been in the military, all those kind of things. They are part of the science. Then talking to seeing things that are not there, or feeling things.
Somebody's asking a question next when she said, what about mental issues that is caused by juju? Can it be
Well,
cured medically?
unfortunately, as a professional, I can't comment on that because
Yes.
we don't
Because there's nothing
recognize
like
juju.
juju. There's nothing like juju in medical terms.
Yeah, we don't recognize
We
that.
don't
So I won't.
recognize it. It's true. There's
Yeah.
nothing like juju in medical terms. Is it that it what it is? That's just
Mm,
it. Yeah.
yeah.
So
So yeah. So what was I saying? What
you were
were we
talking.
saying?
You were talking about the types of mental health.
Yeah, so yeah, I was still talking on schizophrenia. So some people might see things that are not there, or hear voices that are not there, or even feel something. They could start feeling like something is exploring all over their body. So
Yeah.
but it's not actually real, but that's just the feeling they have. And paranoid. I've talked about paranoid when they are
Yes.
kind of
It's kind of
suspicious of
suspicious.
people, thinking people did things to them that the person didn't
Most
do.
probably. Mm.
Yeah. So that's schizophrenia. There are so many symptoms there. And with depression, we already know, everybody knows depression, but sometimes depression is not as easy as telling the person to pick up themselves.
Yeah.
Do you understand? It's not just as simple as, oh, you should be happy, you have everything, because that's the mistake we make. We think, oh, you're married, you have children, you have money, and all that. Because of that, the person shouldn't be depressed.
Mm.
Sometimes there's some chemical imbalance in the brain that makes it impossible for somebody to feel happy and alive and
Mm.
fun the way normal, not like normal people you would expect
No,
normal
that's
people
it.
to
Mhm.
do. So just being negative or being judgmental doesn't actually help the person. So these
Mm.
symptoms can be that the person doesn't want to associate with people, doesn't
Mhm.
want to do things that they are not motivated. Sometimes it could even come as physical symptoms, too tired, fatigue, exhausted all the
Mhm.
time. Yeah. And then not even having any hope, hopelessness, not
Yeah.
having any plans of the future, like thinking like there's not life is not worth living anymore. So in that situation, some people might start considering ending their life, having those negative thoughts
Guilt.
to end their life. Yeah.
Mm.
And a lot of people also, women, will get into menopause. Sometimes that menopause can impact people negatively, and some of the things
Wow.
people suffer with can be depression as well. So that's
So
another bridge.
women going into menopause can also suffer mental health.
Yes, yeah, it affects people mentally as well as physically because a lot of changes are going on, and that's why some marriages suffer at that stage as well. Because
Mm.
a lot of things is happening to the woman that she doesn't even understand herself. So
So
that's another area maybe to look at some other time.
okay,
Yeah,
yeah, yeah,
because
yeah.
that those changes have a huge impact.
Maybe the next one we'll talk about menopause,
Yeah.
the changes
Yeah,
and mm,
yeah, that would be good. So, yeah, that's depression. Then we have bipolar as well. So
mm,
bipolar is also um, it's like two extreme.
mm.
So when the person is happy, they are happy. They are too excited. They feel like they will conquer the
Exagitated.
world. Yeah,
They are
there's
exaggerating. Their body.
yeah.
Mm,
Yeah, they want to do everything. So in that situation, the person might not even sleep at all. They are taking up too many projects. Sometimes they are spending recklessly.
mm.
Uh, so like overdoing everything to the
Things.
extreme where it becomes dangerous to them.
Mm.
Yeah, yeah. Whereas the other end of it is depression as well. So it's like when the person goes up, they are up. When they are down, they are down. So
Down.
there's no middle. So
Wow.
that's bipolar as well. So there are different diagnoses, but the main thing is what are the appropriate support that person needs at that point in time for. Yeah, sometimes it could be medication, it could be combination of medication and talking therapy, CBT, different sort of psychological therapy. Um, so just like trying to support the person from different angles.
Angles.
Well,
Mm. Wow. Wow. This mental health thing, I used to think it's just one small. From what
well,
you've explained here, it's a very
yeah,
big.
it is. It's
Hmm.
huge. Yeah.
It's really huge. It's really huge. It's huge. Okay. I want to ask. Maybe this will be my second to last question, so that because I don't
Okay.
want to keep you, so that I know you have got family and things to do.
Yeah.
I really appreciate, guys. Please, can you share, put on the love button for her. She's here in a very short notice, and she honored my invitation, and I appreciate that. So guys, please put the love emoji, please. Let's appreciate Gloria. All right, let's appreciate her. And if you have any question, guys, please type it on the comment section. We'll read them out. Okay,
Mhm.
we read that one before about the juju one. All right.
Thank you.
All right. I wanted to ask, as a mental health nurse, can you please
Mm,
share your experience or share idea for anyone who might want to be a mental health nurse or a carer that want to go into mental health? What are the
okay.
things they should look out for?
Okay. So, if you're considering a job in mental health, you have to understand your why. Why do you want to go into that? And
Mm,
what sort of experience have you had so far? So, if you're already working in healthcare and you actually you've seen what's happening there, you have an understanding of how how the system works and you still want to go into it, then I'll say go ahead and do it. But understanding your why is more important because that's what will take you through the challenges and the
Angie.
stress, even while you are at uni. So do your research. And another thing is also finding out what the criterias are because there are different routes of going into nursing. So some people can go into apprenticeship route, which is band three, and
Okay.
you are sponsored by the trust or the
Oh, they
organization.
sponsor band three, they sponsor, eh?
Yeah, they can sponsor you.
Okay.
to do the apprenticeship program. And
All
most
right.
of the time they go to university once in a week, and the other 30, so they do 7.5 at university and
Mm.
4 days on in placement. So it's like they
Mentally.
are working and getting paid.
For it.
They will be paid their normal salary at band
Mm.
three while they
Wow.
are studying. So it's kind of good for people that want to take that route. But then you only get to band four. After that, you become a qualified nursing associate. So you
Mm.
can work, you'll be registered under the NMC, and
Okay.
you'll be able to do most of the things the nurses can do anyway. Just that for some organization, they cannot manage a ward on their own,
Okay.
and then there are just little bit of things they might
Mm.
not be able to do, but they are like qualified nurses.
Nurses.
But the limitation there is that you will never grow beyond that.
Mm.
So they will need to go back to uni again, either sponsored by the same organization to complete their band five, complete and
Okay.
become a band five nurse. Once you become a band five nurse, there's not really much limitation anymore because you can just grow from there to whichever band you want. Obviously, you'll be supporting yourself with additional training, but you don't necessarily have to go to university or do a master's to progress again.
Mm.
Then there is the degree program, obviously, which everybody knows, which is the 3 years program. And then recently we have the 2 years program. So it's called Masters Pre-registration Nursing.
All right.
So people can go through that 2 years program as well. But for that, you need to have had experience in healthcare
That's healthcare. Mm.
as a healthcare assistant or worked in education. I know during my time, education or social works. So, but do your research, find out what that university wants, wherever you live. If you live in London, maybe look at the universities around that you're interested in going to, look at their eligibility criteria for the
Okay.
subjects and for the experience as well, and see
Okay.
if you're able to meet it. If not, you can start to work on it on
Mm.
time rather than waiting till last minute. Mhm.
Okay. Okay. All
Thank you,
right.
Mary.
Yeah, everybody's really enjoying the topic, and I'm
Mhm.
also enjoying and also learning. Yeah.
Thank you, Gloria.
Thank you so much. Guys, please follow her. She's on TikTok.
Mm-hmm.
She's let her tell us her handle so you can follow her. She teach more on mental health, everything else.
Mm.
So you might like to go there and watch our videos and learn one or two things. So please, can you share your handle with them, please?
Okay. Is there a way to put something in the comments? Yeah.
Yeah, you can type it on the comment if okay, you
Uh,
can type it or you can say it.
I can't see. Anyway,
Mm.
on TikTok, I have another new TikTok profile. Is that mental health nurse?
That mental health nurse, guys. So on TikTok,
Mhm.
she is that mental health nurse.
Yeah.
All
And
right.
then there's another one that is Glorious Lifestyle. Glorious underscore lifestyle.
Yeah, glorious underscore lifestyle.
Yeah.
Glorious underscore lifestyle. Yeah, I hope we got that. So you can follow her and learn more. And maybe you wish to become a mental health nurse in the future. So at least you have the basic ideas and
Mhm.
what to do and how to go about it. Okay. She's a very loving person. She's friendly. Like I said, I met her here on the internet space on TikTok. I met her on the TikTok and we became friends. So that's why you need to be on the social media. Social media is not about gossip. You can learn things, meet your destiny helper, meet a lot of people. So just make sure that whatever you do on your social media space is positive and is something that people want to learn from you and
Mhm.
share ideas and you also learn from people. Because in
Yeah.
life, honestly, we all keep learning. Like now I've learned something else and I'm sure my viewers as well have also learned one or two things today. So Gloria, thank you so much for coming
Oh,
here Trust me, I really appreciate. Thank you to all everyone who is here. Excellent TV, Mary. I'm gonna call everybody's name. Natural TV, Victor, Daddy Child, Empire, um, Frank, Empire. I don't want to miss anybody's name. Grace. Um, who else again? I think that's so. Thank you to everyone who joined, who is listening, everywhere in the world. Thank you guys. Please, is the spelling correct? That is mental health nurse. Is that it?
Is that's mental health nurse is
That's
together?
mental health nurse. They are
No.
together, that's mental health nurse.
Yeah.
That's mental health nurse. As
Mm.
in, is this
And
spelling correct?
it's
It's TH.
THAT,
That's what I want to. Yes,
not
THAT.
D.
Not D,
Mm.
yeah.
Yeah.
THAT. That's
Yeah.
mental.
Mary is correct.
Maybe did she type it?
Yeah, she typed it correctly, but they are one word, so there's no space in
There's no
between.
space. Okay, yeah, they're all together. TikTok how it is. So if you're on TikTok, you will know. So is that
Mm.
mental health nurse? They're all together. There's no space, there's no comma, there's no anything on it. All right.
Mm.
Her name is Gloria. Okay, so look at the face now, mark the face so that when you get to TikTok and you see the profile who is on the page, you know she's the one. All right, guys. So does anyone have yeah, excellent. Now I think you got it. That mental health nurse. Yes. Yeah. So does
All right.
anyone have a question so we can go? That mental health nurse. Yes, Natrich
Yeah,
now
that's
got it.
correct.
That's it. That's correct. That's correct. Yeah,
Mm.
thank you. Yeah, that's the right one. So does anyone have a question before we go? Please share please subscribe to my channel, like the channel, press on the tap on the screen, tap 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 if you really enjoy this section with me. All right. Thank you to everyone that is watching me here today. Wherever you're watching me in the world, good morning, good afternoon, good evening, good night, because we all have different time zones. So thank you to each and every one of you. Is it just only mental patients she deals with?
Yes, yeah. So
Yes.
in nursing, there are different field of practice. So mine is mental health.
Yeah.
There'll be people on adults. So when you talk about adult nursing, it will be like general hospital, people with physical health problems.
Mm,
And then you have the children also, and you have learning disability
yeah.
as well. So
Yeah.
mine is mental health patients. Obviously, as a mental health nurse, you're also dealing with your physical issues as well because people with mental illness have physical health problems. So
Mm,
as a professional, you are there to also pick up on signs of deterioration and
okay.
also offer appropriate interventions,
Mm,
probably maybe escalating issues to the doctors, A&E, or you didn't need admission in hospital, we still have to send staff to support them while they are admitted. So
mm,
it's providing holistic care, and you're working with different professionals as well, social workers, doctors, GP, and any
everybody.
everybody. Yeah. Yeah.
I
Thank you,
understand.
Excellence. Yeah.
All right, all right. Thank you so much, Gloria. I really appreciate this section.
Thank you so
So,
much for
yeah, I will
having
see
me
you
here.
guys on our next. We'll look another section. Maybe she's going to teach us something else, because in this social media space, we should learn everything and anything. All right. So, Gloria, thank
Mhm.
you so much. I really appreciate it. Thank you to you guys. And I
Thank
will
you,
see you
sis.
guys in my next video. Please subscribe, like, support me in any way you can, okay? So that it will motivate me to do more. All right. So thank you, bye guys. Thank you, Gloria,
Thank-
and we'll see you
Bye,
again.
everybody.
Bye
Have a
bye,
lovely
everybody.
day. Bye.